Hi, I'm Sonya C. I'm a women's health nurse practitioner at Scotland County Hospital and Clinics in Memphis. January is Cervical Health Awareness Month, and I want to tell you about some ways we can screen for that type of cancer and ways to protect against cervical cancer. The main cause of cervical cancer is HPV. This is a long-lasting infection that has different strains, and it's the higher risk strains that cause cervical cancer. HPV is a common virus that is passed from one person to another during intercourse. At least half of sexually active people will have HPV at some point in their life. However, very few women get cervical cancer. Generally, you clear this much like you would clear a cough or a cold, but for those women who don't clear it, it can stay there, which is then what causes cervical cancer. So every year about 12,000 women are diagnosed with cervical cancer and 4,000 women die from this disease in the US. One of the ways that you can prevent cervical cancer is by getting the HPV vaccine called Gardasil. Gardasil helps protect against 9 of the higher risk strains that cause HPV. Gardasil is recommended starting at the age of 9 through the age of 45 for both men and women. If you get the vaccine prior to the age of 14, it is only a 2-shot series. If you start the vaccine after the age of 14, it is a recommended 3-shot series. Having the HPV vaccine does not take the place of recommended cervical screenings, even though it would reduce your risk of getting cervical cancer. A cervical cancer screening, most commonly referred to as a pap smear, is used to find changes in the cells of the cervix that could lead to cervical cancer. Girls under the age of 21 are not recommended to have pap smears regardless of sexual activity. Females ages 21 to 29 are recommended to have cervical cytology every 3 years unless they have had a history of an abnormal pap. For women ages 30 to 65, it is recommended that they have co-testing, which would be a pap smear along with an HPV screening. If this is done and both tests are negative, they can go 5 years between cervical cancer screenings. If you are 65 and older and have never had an abnormal pap and have had one within the last 5 years of turning 65, you no longer need cervical cancer screenings. If you have had a hysterectomy, not due to cancer, meaning you had it for abnormal bleeding or some other reason, then you no longer are required to have pap smears unless, of course, they left your cervix, which that could be the case. If you have ever had an abnormal pap, these guidelines do not pertain to you. You should have a pap every year if you have ever had an abnormal pap smear until directed otherwise by your clinician. Also, even if you don't need a pap smear, it is a great idea to still schedule an annual wellness exam at all ages. If you are a female aged 35 to 65 and you are uninsured or underinsured, you may qualify for the Show Me Healthy Women program. It is a program that provides free clinical breast exams, cervical cancer screenings, and mammograms for women in Missouri who meet the age, income, and insurance criteria. Show Me Healthy Women is funded by the Centers for Disease Control and Prevention and several national, regional, and local partner organizations. Please call and inquire about this program as we at Memphis Medical Services are Show Me Healthy Women providers. Please encourage your friends and family as well to inquire, as it is an excellent program if you are in need of preventative care. Please reach out and talk to your primary care provider about a cervical cancer screening or call Memphis Medical Services at 660-465-2828 to discuss your options for cervical cancer screening and/or any questions you might have about the Show Me Healthy Women initiative, or if you need an appointment for a wellness exam.